Alrighty, looks like we are good to go. We are here on Zoom, we are on Facebook, we're everywhere. So thank you all for joining us this afternoon. My name is Taylor Moore. I'm the Communications Director at Defend Our Health, and I am joined today by Professor of Pediatrics, Environmental Medicine, and Population Health at NYU Langone Health, Dr. Leonardo Trasande. Dr. Trasande is an internationally renowned leader in environmental health. His research focuses on the impacts of chemicals on hormones in our bodies, and he is the author of Sicker, Fatter, Poorer, the Urgent Threat of Hormone Disrupting Chemicals to Our Health and Future, and What We Can Do About It. And we have partnered with Leo today for Giving Tuesday, for Giving Tuesday Challenge. If you make a one-time donation of $100 or more, or if you sign up to become a hero for health by making a monthly recurring donation of $10 or more, you will receive a copy of his book. The campaign will directly benefit Defend Our Health Spring internship programs for organizing, research, and communications, which trains college students and early career professionals to work at the intersection of environmental health and justice in the nonprofit sector. The link to the donate page should now be available in the chat, whether you're on Zoom or if you're on Facebook. If you have any questions during the interview, please feel free to drop them into the chat, and hopefully we will have some time at the end to take a few of the questions. So, deep breath. That was a lot. Let's get started. So thank you for joining us, Dr. Leo. What is your current role, and how did you become involved in this work for human health and the environment?
So I came into the impact of environmental health in a bit of an unusual way. First and foremost, I'm always delighted to work with you, Taylor, and Defend Our Health is such a great organization. I finished my pediatric residency. I'd gotten a master's in public policy with my medical degree. So I was very interested in health policy and had the privilege of, after my residency, working in the office of then Senator Hillary Rodham Clinton, working on children's and environmental policy. And I figured, well, I've got the children's health part down, and the environmental health part I'll figure out as I go. Boy, was I in for a surprise. I mean, you don't get environmental health much in medical school. You get an hour here, an hour there, get a little bit about lead exposure, a little bit about air pollution. That's about it. And I realized how broad the impacts of these exposures are, not just for kids, but for all of us. And so I decided to embark on a career where I would study these exposures, particularly exposures that affect hormones in our bodies, and thereby contribute to disease and disability across the lifespan. And now I'm at NYU, where I direct a Center for the Investigation of Environmental Hazards, a large group of scientists across multiple disciplines who are trying to understand what environmental factors are doing to our bodies, and ultimately trying to drive policy that ultimately protects us appropriately.
Okay, so you mentioned this. So this is obviously not an issue that only affects children or only affects adults. It's affecting all of us. And last month, CNN Health covered a recent study of yours on a toxic chemical called phthalates. Where are these toxins coming from, and how are they getting into our bodies?
So phthalates are almost everywhere chemicals, in that they've come into use because they make scents stay longer, and they also soften plastics. So they've come into use for many years now in personal care products, cosmetics, and food packaging. If you look at levels of phthalates in the US population in national surveys, they found that nearly all of us have these detectable levels in our urine. And we did a study where we looked at levels of these chemicals and chronic disease ultimately, and death and disability from chronic disease. It's long been known that these phthalates can hack the male sex hormone testosterone, contributing not just to potency and fertility, but also potentially to heart disease, because low T or low testosterone is a marker for a predictor of adult cardiovascular disease. It also is a chemical that can literally make us fatter. So independent of diet and physical activity, it can contribute to obesity, and it modifies how the body responds to sugar ultimately, and can thereby contribute to diabetes. So when you put that together, obesity, diabetes, and heart disease, you have a setup, if you will, for increases in mortality. So we linked data from this national survey to data from the National Death Registry, because people count when people die, et cetera, and looked at the time span of about 10 years. And unfortunately, we found that phthalate levels 10 years prior were associated with earlier mortality in a nationally representative sample of Americans. And if you extrapolate or interpret the findings and apply them to the US population, it means that 100,000 people in the United States die each year between the ages of 55 and 64 due to phthalate exposures. Now, sure, we got to do more research, but it raises some serious concerns about why we're gambling with our health.
Okay. And so you said 55 to
64 years of
64.
age.
Okay. And so with as a pediatrician, how is children's health specifically being harmed by phthalates and other chemicals in everyday products and packaging?
Well, children are developing extremely rapidly in early life. So as much as I've already rattled off a pretty jarring consequence for older folks in the US, the reality is that kids are uniquely vulnerable because during pregnancy and in childhood, their organs are rapidly developing, their metabolic systems are being programmed. And when you disrupt sex hormones, we've talked about testosterone, you can have effects not just on the male reproductive system in the case of testosterone, but brain development, because sex hormones are crucial in shaping brain development in young kids. So unfortunately, we've identified that male reproductive development in particular can be disrupted by phthalate exposures, and studies have suggested that there may be particular effects on boys, especially on their brain development as a result of exposure. And what we talked about in adults with obesity and diabetes may also be the case in early life exposure to phthalates, because pregnancy is a particularly vulnerable window, and phthalates appear to disturb growth in pregnancy, such that a baby is born with a lower birth weight. And when you disrupt growth that way, you program the body to take on more calories outside the womb. And if calories are no longer restricted, you can have a setup for a child gaining more weight than they're supposed to, because their body is focused on compensating for what it perceives as a nutrient poor environment during pregnancy. They call this the thrifty phenotype. That occurs as a result of these phthalate exposures. And that's how phthalate exposures during pregnancy can attribute it all the way to obesity and ultimately diabetes in youth.
Wow. Okay. And so what are some of the biggest misconceptions that you've encountered around people's understanding of toxic chemicals in the environment?
So as a medical student in the 1990s, I was taught that only the dose makes the thing a poison. It's a phrase that dates to 1500 or so. This Swiss philosopher named Paracelsus, or Theophrastus Bombastus von Hohenheim. I like saying his name because it's such a mouthful. But the reason I say it is not to make you laugh. I'm glad I did. It's to highlight that this guy's philosophy has stuck around for 500 years, all the way such that I, as a medical student, was being taught almost like everything in moderation, right? So it's common sense. So it feels like it makes sense, right? Well, unfortunately, science has caught up. And over the past 25 years, we've realized, oh my goodness, little things really matter. And at the very lowest exposure to these chemicals, especially when you're hacking hormones, that's what these chemicals do. You have a situation where at the very lowest levels of exposure, the biggest jumps in adverse health effects, such that what you really need to do is get as close to zero, if not zero, in the exposures if you can. You can't assume that from experiments in animals where you look at high doses of these chemicals, you can extrapolate down to look what happens in low levels of exposures in humans. I mean, I'd like to think that it's true, but I can't deny the data that have come out and have been reported by the Endocrine Society, a scientific organization of tens of thousands of scientists from 100 countries, the World Health Organization, and the United Nations Environment Program. And even, I'm proud to say, my own American Academy of Pediatrics has really put emphasis on these endocrine disrupting chemicals and their implications for contamination in foods and their impact on kids' health.
Mhm.
Particularly when it comes to kids, timing is everything. So even a little thing at the wrong time in a kid's brain development or metabolic programming in pregnancy or puberty can scramble a body's system in a way that has permanent and lifelong consequences, because you can't rewire a child's brain, just like you can't reprogram a child's metabolism. And so even these little exposures at the wrong time can have consequences that are permanent and lifelong.
Wow. Okay. Okay, 1 second. So it looks, I'm getting a message that we forgot to start recording, which is important. Yes. So hopefully that's okay with you, Leo, and with everybody else. I'm going to record from this point forward.
I'm good.
Let's see. Okay, so we are recording. Okay, so basically, so for someone like myself who does not have a background in science or in medicine or in health, so basically what you're saying is a common misconception, and this is something that I've learned since being on the team, is that people often think that with chemicals or with anything bad, as long as you're not getting it, eating it, consuming it, it's not affecting you in excess in these large amounts, then it's fine. But really the case is that these toxic chemicals, phthalates, PFAS, things of that nature, they're very dangerous even in small amounts. So, what we want to do is, create policies or educate folks or, to avoid them at all costs, but that shouldn't be the responsibility of the consumer or the individual, under all circumstances. But these chemicals are dangerous even in small amounts.
That's right. Unfortunately, science has borne out that our assumptions were flawed. This is somewhat like a paradigm shift that happens that unfortunately has consequences for the way we live in this modern environment. Look, nothing I'm saying here suggests we need to go back to 1700 or even 1500, around the time Paracelsus lived. But this assumption that only the dose makes the thing a poison is just increasingly flawed. It's not universally flawed. There are things that make sense, and every little bit you have a stepwise increase in the effects. The problem is hormones don't follow straight lines. Hormones follow U-shaped or roller coaster ride relationships, and those relationships are based in biology. They were designed by nature in a way that means we have to account for complexity. And that means that at the very lowest levels of exposure, you can have the biggest effects, which means that the biggest bang for your buck when it comes from prevention comes from preventing at the lowest levels of exposure.
Okay. And so the title of your book that we're using today in our giveaway starts with, as I mentioned before, Sicker, Fatter, and Poorer. You've touched on the sicker and fatter, and of course, please feel free to expand, but also the poorer piece. Could you explain why you chose that as the start of your title? What's the significance of that?
So just to hammer a little bit on the sicker, it's not just our brains, it's not just our metabolism, it's not just reproduction that's at stake. We've already touched on a few of those. There are certain cancers that have been traced to these hormone disrupting chemical exposures, particularly breast cancer, but prostate cancer and a host of other reproductive and other cancers can be traced to these exposures in early life when you hack hormones, and thereby contribute to disease and disability. So that's the sicker. We've talked about the fatter because these chemicals can really scramble the way our metabolism works. So just to talk about perfluoroalkyl substances or forever chemicals, these chemicals used in nonstick cooking and oil and water resistant clothing, these chemicals seem to undo the body's metabolism by turning down the resting metabolic rate. So in a study where people had lost weight through healthy diet and physical activity, the levels of PFAS were associated with greater weight gain back. So this is undermining the progress they had made by doing the right thing, good lifestyle. And they gained that weight back. So nothing here I'm talking about undermines the basic premise that unhealthy diet and unhealthy physical activity or physical inactivity are the key factors driving the obesity and diabetes pandemics. Unfortunately, we have a situation where there's a third important factor. It's a three-legged stool where you have diet, physical activity, and environmental factors, particularly environmental factors that hack our hormones that literally make us fatter. There are 50 or so known chemical obesogens that have been identified. We haven't talked about this, but just to dwell on it for a moment, bisphenols are used in aluminum can linings and thermal paper receipts. They're synthetic estrogens that can have sex-specific effects on body mass. They antagonize adiponectin, which protects the heart, and they make fat cells bigger. So literally can program the body to retain weight and undermine all those hard-fought gains that we're trying to achieve in these days where the pandemic is even magnifying things and keeping us home more and limiting our physical activity and or changing our diet in ways we don't like. Let's talk about the poor for a minute, which I think is really important. So these chemicals arise because companies are trying to make a profit. Let's be honest about it. And the fact is there are consequences to the use of these chemicals that aren't considered in the bottom line and are leading to overproduction of these chemicals and costing our health ultimately. We did a series of studies back in 2015 and 2016, just looking at the strongest evidence for effects of these chemicals on human health. When we looked at the disease consequences and just the disease consequences, that the subset that could be traced to the chemical exposures we're talking about, the costs in the US are $340 billion a year, 2.3% of the gross domestic product. And that was based on less than 5% of known endocrine disrupting chemicals, a subset of the diseases due to the few chemicals we were able to study, and a subset of costs due to the few diseases due to the few chemicals we were able to study. So this little part that we looked at was 2% of the gross domestic product, but that percentage is an underestimate of an underestimate of an underestimate of a bigger problem. We talked about phthalates and mortality a little while earlier. When you have adults that are dying early during their peak earning years, they're not as well able to contribute to the economy. And when you count up the lost economic productivity, the cost of 100,000 adults dying at that age window is $40 to $47 billion a year. So that's in addition to that $340 billion I already talked about. So when policymakers or companies say, well, it's too costly to replace something with a safer alternative, they're arguing that the consequences are small of these chemical exposures. But the reality is these consequences are not just big for our human health, for people's lives, they're big for our economy as well. They're undermining our own economic productivity during these tough fiscal times.
Okay, so let's take a slight pivot here. Can you expand on why all that we're talking about is what the intersection of this with, or the intersection really with environmental health and justice? How is this a social justice issue from your perspective?
Unfortunately, we know that disparities run by race and ethnicity and economic class. And when you look under the hood of that problem, and it's a big problem, you see that environmental exposures also they shake out in a way that's patterned by these same factors. Sometimes it's direct marketing, unfortunately, which is really awful to talk about, when certain hair products or food packages are being targeted to communities who are less well able to afford other alternatives, or they're really just being intentionally marketed to particular populations. And when you do that, not to mention other factors that drive less access to healthier foods or foods free of food packaging, for example, that means that communities of color and low-income communities have higher levels of many of the chemicals we're talking about detectable in their urine. And you can take that, unfortunately, all the way to increases in disease burden. Those are health disparities in chronic disease that you can trace to disparities in chemical exposure. And this is on top of a whole legacy that's horrible of intentional dumping of waste and hazardous waste sites and siting of communities near chemical exposures of concern. So unfortunately, you have this snowball effect, which I'm not suggesting that the entirety of disparities in chronic disease can be tied to chemical exposures, but this is probably a big and under-recognized explanation for tragic disparities in obesity, diabetes, and even certain cancers that can ultimately be traced to chemical exposure. So it speaks to the value of prevention in these communities and the impact of policy prevention in mitigating those disparities.
I'm curious, you said something interesting, the direct marketing piece is something that I've, again, since joining Defend, have been more aware of, as obviously a Black woman who obviously uses certain products or is, I know that there's marketing catered towards myself. And so do you have any specific examples though of something that like you've seen that is direct marketing that this is definitely, just in case the audience is like thinking about that, this is definitely something that is a part of this?
The case I've seen colleagues describe, which to me is disturbing, is in hair products in particular, and certain cosmetics that are being marketed. I can't say if it's consciously being done by certain companies to communities of color, but unfortunately, when a product has more of that chemical and it's being sold more to those communities, that you connect the dots, and that walks all the way to higher exposures that can contribute to chronic disease and harms their health. It's not, you can argue whether it's conscious racism or unconscious. It's horrifying all the same.
Yeah, absolutely. And in your book, you talk about what consumers can do to protect themselves, and also how they can use political pressure to demand change. I'm wondering how you see the role of private companies in all of this, which is something like, the example you just gave, what we just kind of talked about a little bit.
Right.
In our own work in developing a field guide to less toxic materials for the food industry, we discovered that safer alternatives to food contact materials are absolutely available, but industry can be slow to adopt alternatives. Can you talk a bit about what you see as the role of the private sector and our exposure to toxins, and what changes would you like to see companies make to their practices and products, especially in the absence of public policy that protects the public from toxics?
So we've talked about the negative consequences induced by companies, but I see a lot of the solution coming from companies that are doing the right thing.
Nice.
We've seen time and again companies leading the way, guiding. There's sometimes these, we have upstream like fast food places, or they're just taking what they know is available in terms of food packaging. And then you have leading companies saying, hey, I don't want to see these perfluoroalkyl substances or phthalates or bisphenols in these food packages, and they're selling it. And it's not changing the bottom line of the supermarkets or the, or the fast food places, and they're driving the change that we all seek, and they're gaining more market share in the process by doing the right thing, because people see that they have the power of their pocketbooks and their wallets. Time and again, we've seen consumer attention drive prevention. We had 2 major supermarket chains literally get PFAS out of their nonstick, out of their food bowls in the supermarkets, just because of a study of just 5 samples. 5. This wasn't a big study. This didn't even get published in the peer-reviewed literature. Didn't need to be. It was there. That was enough data to make 2 major supermarket chains do the right thing. We've seen it with eating organic too. And a lot of people tell me, oh, Leo, it's a bougie thing. It's not really helpful. Well, the fact is, you see an explosion, a double-digit percentage gain year on year in organic as a percentage of market share. When that happens, you see the big box stores all of a sudden saying, oh, this is time to get involved in the organic food sales business. And then they put their organic food side by side with the conventional food. And guess what happens? When you have market scale going up, you have a situation where the price point used to be organic was way too high for low-income communities to afford it. But all of a sudden, the price point started to drop. And all of a sudden, it became comparable, such that you're seeing the big box stores put them side by side. And people are smart, and they're going to do what it takes to protect their health. And we know that eating organic in high income as well as low income communities can reduce kids' levels of pesticides in their urine. We've seen interventions in low income communities as well as high income communities reduce levels of phthalates in their urine. Different kinds of interventions have achieved that successfully. So when someone tells me, oh, this is just a thing for the well-to-do to worry about, no, the data suggests that we can be the change we seek for everyone. Look, policy is going to be an important pedestal for this solution, but there's so much we can do even when the federal government is failing to step up. And let's not forget the states play a key role too in accelerating the change. The states are the laboratory for the federal government, and many states have taken the lead on policy initiatives that have made the companies change their habits for the entire country. Because you can't have Maine, New York, Washington, and a few other states have a special version of, let's say, mac and cheese. It ends up being the entire country having the same mac and cheese free of phthalates.
Yep.
And that's positive change. You're seeing that now with clothing. All of a sudden around Black Friday, I saw PFAS free start to appear in the option menu on the left-hand side of certain sales systems.
Okay.
People are watching, and people are starting to appreciate that these chemicals are concerned. They want to get rid of it.
That's exciting.
On behalf of their health.
I didn't know about, I didn't know about the PFAS free. That's cool because we're talking about REI and certain clothing that needs certain things or doesn't need certain things, and so it's exciting. It's exciting to hear. As more and more things are becoming normalized for, like you said, for everybody, because there's a lot of times when it's like, okay, these higher end products that are healthier and stuff are, like you said, for well-to-do folks. And even literally yesterday, Publix, the 6 green apples organic was, I think, like 67 cents more than non-organic. And I was like looking at that because I switched in my back, like in my little, it was on Instacart, switched it in my basket. And I noticed that genuinely, this was no joke yesterday. And it was like 67 cents different. And I was like, this must be a mistake for like 6 apples. Because usually you would think like the organic product's going to be what, $5 more, $10 more overall. So that's just one very small example. But so it's interesting to hear you say that that's actually something that's happening across the market. And I think it's good. I want people to know about that. I want people to think that they, what are my options? Can I buy organic? What's the actual difference? And so now my brain is turning like, okay, what kind of information or resources or things can be provided that, show like it's a little bit more expensive, but it is doable and things are changing and it's more accessible. And so from my sociological perspective, I'm like thinking about food deserts and all. It's important. It's important it's exciting to hear that, there are changes that can be made to make things like this more accessible to more people, because that's really what's important in a lot of ways.
Nothing I'm suggesting here means that, and nothing that I'm suggesting here minimizes the reality of food deserts that are out there.
Yeah.
At all. And I'm not suggesting that everyone right now can click their heels, snap their fingers, and all of a sudden get a fully organic PFAS, phthalate, bisphenol-free meal everywhere they go.
Yeah.
However, if we don't rise up and speak out and call the truth to the science and be the power, we're not going to get there any faster.
Yeah.
So we all have to just rise up a bit. And again, companies care about their bottom line, and the power is up in the consumer's hands.
A lot of them, and like you said, it's a lot of folks who just smaller companies. Like we worked with Brew Dr. Kombucha, who had phthalates previously, and the plastilaner for the bottle caps for some of their beverages we tested, and it was a phone call. It's just informing some people, and they're like, what, this is in our product? Absolutely not. I'm gonna make that change. Like you said, a lot of them really, really do care. And some folks, especially the smaller teams, just don't know. So definitely agree with you there. But so to keep it moving, in your book, you also explain very clearly what endocrine disruption is. Can you share that explanation with us today? I mean, you've talked about it a little bit. So then I don't know how much more you need to expand on it, but then can you also explain how plastics are related as a danger to human health?
So when we're talking about endocrine disrupting chemicals, first we have to take the endocrine part. Endocrine is our basic signaling molecules, underlying temperature, metabolism, salt, sugar, and even sex. When we're talking about endocrine disrupting chemicals, we're not talking about the natural hormones. We're talking about synthetic chemicals that hack those natural molecular signals and thereby contribute to disease and disability. What we know in plastics are the softer plastics tend to have phthalates, these chemicals that antagonize the male sex hormone. They disrupt the function of proteins in the production of proteins that are crucial for lipid and carbohydrate metabolism. So sugar and fat, and they misprogram how the body processes. Let's say you've had a good protein meal, protein heavy meal, I should say. You've had a good workout. You're thinking, all right, I'm going to make muscle. Well, the body is now misprogrammed by these chemicals to turn that into fat or sugar. And that's not what you wanted, but that's what happens when these chemicals hack your metabolism. And then we know that these chemicals can mess with brain development. Thyroid hormone is crucial for a child's brain development, and baby doesn't make thyroid hormone until the second trimester of pregnancy. We know the pesticides and flame retardants in electronics and furniture hack that thyroid hormone, thereby contribute to disease and disability. And it's important to say that there's what we know and there's what we don't know. I'm not saying we know everything, but what little we know suggests that 1,000 synthetic chemicals in our daily lives contribute to disease and disability by scrambling our molecular signals. We haven't tested every chemical that's out there, the 100,000 plus chemicals in our daily lives, for their effects on hormone health.
Where am I? And yeah, so sorry, there was a comment that popped up. We had somebody share, and I think this is kind of going back to what you're talking about. Claudia shared with us an example of direct marketing to toxic products to communities of color. So it's, yeah, I mean, it's something that's happening and people are talking about it. And oh, and I have a question here too. I'll say that for a little bit. So yes, a couple more. So, as you know, our Giving Tuesday campaign is for our internship program and organizing research and communications. You're at NYU, working with young people in academia. And I had the pleasure of getting a little snippet of this when we chatted a couple weeks ago. But how important would you say the conversations you're having with students about the intersection of environmental health and justice? And what do you think those conversations mean for the future?
So I like to think that what I do is as much for the next generation as well as for the one I'm in. And when I teach undergrads at NYU, I get a lot of hope because much like climate change has transformed their thinking about environment and health, they're starting to become woke, if you will, to the broader notion that these contaminants affect our daily lives. So if you cool the planet and you don't deal with these chemicals, which by the way, often come from oil and petroleum use and production, you're going to have a planet that's cooler, but you're going to have people that are poisoned in a way that they can't enjoy what's there for them. And what I tell those folks when I teach them is that, you know, they're smarter by 4 to 7 IQ points because it's something that was done that didn't help me. So getting lead out of gasoline occurred in the 70s when I was just born, and the average lead level of a kid my time was 15 microgram per deciliter. It's 1 now because we got lead out of gasoline and out of paint.
Okay.
And over the population, that's increased our cognitive potential by 4 to 7 IQ points. And by the way, still provides a recurring stimulus package to our economy because kids are smarter and more well able to contribute to the economy of $200 billion a year because we did the right thing 40 years ago, 50 years ago. I'm getting old, but it speaks to the hope I have for the future and the benefits that the current generation have of doing the right thing a generation prior. So we really do have to pay it forward. Okay,
nice. And so this subject can be seen as pretty bleak often, but what are some of the silver linings you see in science, advocacy, policy work around harmful chemicals?
We've seen so much progress in levels of these chemicals going down. We have some problems with replacement chemicals for the chemicals that were on the scene before. You see BPA free everywhere. Unfortunately, we have chemicals like bisphenol S and F and AP and B and Z, just to name a few, that are replacing these chemicals. And in some cases, like bisphenol S, they're as estrogenic, as persistent in the environment, and as toxic to embryos as BPA. So we're whacking the mole pretty often. But in general, we've seen so much more attention to this issue in general than we have 2 decades ago. And policies are starting to change. You see them at state level, you see them in Europe, where now if a chemical is toxic at any level to the endocrine system, if it's a biocide or pesticide, it's banned. Because we don't take risk into account. We don't look at the level of exposure because the dose doesn't always make the poison. So we look at hazard as the basis for regulation. That's not happening in the US as much, but we're making progress. Just look at the attention that President Biden has put to PFAS as another example where you're seeing something other than climate change come into consciousness. That to me represents huge progress. We've got a long way to go. We have to keep pushing.
And I love that last point there, something other than climate change coming into consciousness. I think that is a critical point. It's a key to this because it's very intersectional. It's a very holistic issue. And the climate piece I think has always been at the forefront of the conversation. And so as toxics and environmental health kind of starts to all meld together and we see this is all very connected, especially on the policy level, that's, giving us more space for change. So that's exciting. And we have a couple questions from the audience, if you don't mind.
Sure.
So from Julie Franklin, who works in primary care as an NP and sees all ages of folks. Have you been successful or thought of how to integrate environmental exposure education / information and understanding into everyday practice with your patients with our current time constraints? And do you have educational material that you suggest to have available for patients of all ages?
So one big thing that I say as a practicing pediatrician at Bellevue Hospital, the flagship of the New York City public hospital system, is you have to counsel folks in steps, whether it's about tobacco cessation, whether it's about weight management, a host of issues. So it's about giving people digestible pieces and news they can use and steps they can take at an individual level. So we haven't talked so much about safe and simple steps. It's about not microwaving plastics or machine dishwashing plastics. It's avoiding canned food consumption. It's eating organic when you can, but maybe that's not the highest priority step in families rather, where their resources are a little more limiting.
Yeah.
It can simply be opening the window and recirculating the air to get some of the persistent organic dust that accumulates in homes that can hack our hormones from furniture and electronics and such. So it's looking at the recycling number on a plastic bottle. 3, 6, and 7 are the ones to avoid. 3 are for phthalates, 6 is for styrene, a known carcinogen, and 7 are for the bisphenols we talked about. I wouldn't give a patient or family all those in a 60-second elevator pitch. Give them 1 or 2, see where they are at the next visit, and repeat.
Yeah.
And that's really the way to get to yes. There are educational materials and initiatives that are increasingly being deployed in medical education. Certain medical schools are starting to introduce this straightforwardly into the curricula. It's piggybacked a lot these days on climate change because this generation is asking for it, insisting on it as being part of the medical curriculum. So that also gives me hope.
Okay, cool. And like you said, a couple of things. I'm like 3, 6, and 7. I'm just like already picking. I was like, that's what I'm going to do. I didn't know that. So, okay, cool. Next one, question from Evelyn. Is there a way we can guide ourselves to the packaging as we shop? Yeah.
So first of all, we need to renegotiate our relationship with plastic, period. We have to talk about essential use rather than what we just accept as normal.
Okay.
We've gotten into a bizarre normal where we assume that plastic has to be essential for its own sake. If I'm on an airplane, well, frankly, if I'm on an airplane, I'm refilling a stainless steel bottle for my water, but you don't have to do that. You might get a plastic water bottle if you're stuck between a rock and a hard place on an airplane. But if you're at home where you have a sink and your water's been tested by the city and it's their norms that the federal government requires for the safety of that water, drinking water, you get a glass container and you drink out of it. The same goes for food packaging. Sometimes it's asking some, as a consumer, the questions of like, is there a glass option, or is there at least a Tetra Pak alternative to the conventional plastic wrap, the softer packaging for many of these foods? Often there is. And with time, you're starting to see an evolution back towards glass and stainless steel as the basis for packaging. The chemicals we're talking about and their effects on human health, particularly from plastic, are over and above the ecological effects that we know about, the fish getting choked by plastic, the microplastic concerns that we know very little about the human health effects of those microplastics. But if you see microplastics in the ocean or in someone's body, you see chemicals at a lower level that you can't even see with the microscope in our bodies. You have to use a mass spectrometer and analyze urine samples to find them. But they're having millions-fold higher levels in people's bodies compared to these individual particles of plastic. And they're having consequences for human health that are much better understood than the microplastics. It's even below the nano level that you have chemicals getting directly into our bodies and into our organs.
Okay. And last one here, it looks like. This is from Tristan. And thank you to everybody that submitted questions. Can Dr. Leo please discuss the research into microfibers, fleece? What is the realistic level of risk with synthetic fibers? Is it a concern related to their mechanistic chemical qualities, or both? Yeah.
So to unwrap that question, at least at one level, there's less we know about the direct chemical consequences of exposure from contact with microfibers. But we do know at an ecological level, these microfibers do end up getting in the water systems and into the environment.
Okay. Oh, so that was a quick one. Is it okay if we do another one? They're coming
Please.
in. Yeah, they wanna hear what you have to say, Dr. Leo.
Good.
From Kate Manahan, how does one go about getting a PFAS blood test? Why are they not available readily? That's actually, I've never thought about that. That's a good one.
You know, that's coming. The reality is the safe and simple steps we talk about don't require a PFAS test to do. The focus should really be on preventing these exposures. So most of these tests remain in the research setting, though eventually you'll see this in clinical care. It's going to take time.
Okay. And then last one, this real last one, from Claudia, on the theme of plastic and single-use packaging, have you seen any country begin to end its love affair with disposable packaging?
There's progress. There's some very strong interests at play, and there's a lot of money at stake. So I'm not suggesting you're going to snap your fingers and click your heels and all of a sudden you'll be, in some fantasy land free of plastic.
Yeah.
I'm not even suggesting we get rid of plastic altogether here. I mean, I'd like to quit plastic as a planet and as a society. I think that's a goal that we should aspire to, but we have to walk before we can run.
All righty. Well, I think that is all. Thank you again, Dr. Trasande, for joining me today. And thank you everybody on Zoom and on Facebook who took the time out of their afternoon to learn more about what we do at Defend and the incredible people like Leo that we get to work with. And just in case some folks hopped on and missed our Giving Tuesday challenge, details at the top of the interview, we have partnered with Dr. Trasande today for a Giving Tuesday challenge. If you make a one-time donation of $100 or more, or sign up to become a hero for health by making a monthly recurring donation of $10 or more, you will receive a copy of his book, Sicker, Fatter, Poorer: The Urgent Threat of Hormone Disrupting Chemicals to Our Health and Future, and What We Can Do About It, which is some of what we learned today, what we can do about it. And there's hope. There's hope, and it's exciting to learn about. The link to the donate page will be available in the chat. Any final words from Dr. Leo Trasande?
I have a lot of hope. There's, additional information is on the Defend Our Health website, or you can go to my personal website, leotrasande.com or sickerfatterpoorer.com.
All righty, I'm gonna put that in the chat, leotrasande.com. All right. It's a cool website. I've checked it out quite a few times, so I suggest everybody else do the same. And thank you again. Thank you again so much. And I hope you enjoy the rest of your day.
My pleasure. Have a great day, everybody. Stay well.
Yes. Bye.
Bye.